Hi, it's Rachel Abbott and welcome back to The Standard. Coming up, a trip to London's Forty Hall Vineyard.
We have 3 varieties that make up our champagne blend, Pinot Noir, Pinot Meunier and Chardonnay. And then we have 2 still white varieties, Bacchus and Ortega.
A hidden gem nestled just a few miles away from the heart of the capital. But first, the government announced on Friday that over 52,000 extra urgent dental appointments will take place in London over the next year. That's from 700,000 for the country, as part of a nationwide pledge to pull dentistry out of a Dickensian state of affairs. According to analysis from the British Dental Association, the total unmet need for NHS dentistry in England amounts to 13 million people, or 1 in 4 adults. 1 in 5 patients in London were unable to see an NHS dentist during the past 2 years, according to a GP patient survey last year. Health Minister Stephen Kinnock told The Standard that patients have been left to rip their teeth out, and children's teeth are often rotten. Leaders from the profession have insisted that ministers should have fired the starting gun last summer. Joining us now is Len D'Cruz from the British Dental Association, practice owner and dentist in Woodford Green, East London. Len, does this news come too late?
Yes, I think for us, the commitment to urgent care is really, really important, but it's really essentially a sticking plaster to a gaping wound. The reality is that the fundamental problem here is the actual NHS contract, which has been running since 2006. And despite numerous investigations, reviews by the government and various governments looking at the contract, it hasn't changed. And fundamentally, that flaw in that contract means that dentists don't actually want to work in it. And if I give you an example, because most people don't actually know how dentists get paid, you as a patient will pay a banded course of treatment. It's either band 1, band 2 or band 3. So it'll be £26 for a checkup. It'll be £73 for fillings and extractions and £320 for bridges, crowns, dentures. A dentist actually gets paid in a different way. So if I did 5 fillings, 10 extractions and 3 root canal treatments, I'd get paid the same if I did 3 fillings or 2 fillings. So I get paid as a dentist on the NHS in a different way. So I don't get paid per item of treatment. And it's kind of akin to you saying to your builder, could you build me this house with 3 rooms, but while you're at it, could you also build another 5 rooms for the same price? The answer is going to be no. That's the system that's currently operating in the NHS since 2006. Increasingly young dentists don't want to work in that system.
What would be better? What are the British Dental Association asking for?
The British Dental Association have been asking the government for contract reform for over a decade. And what we want is a basic, you might think we want more money. What we want is a fair and equitable system. So dentists want to work in the system, and what we're looking at is a simple capitation type system, very much like the doctors get paid, general practitioners get paid, a capitation system where you get paid to look after a group of patients. You are paid for some activity, but essentially it's a capitation-based system. And that's what the government piloted up until 2020, for about 10 years, up until 2022. It was a capitation-based system. There's a pilot system for a group practice, and it worked very, very well. But the previous government pulled it, and the current government has no real intention of reinstating that, as far as I'm aware. So
what do the figures from the government mean in terms of appointments? How many are we actually getting in London?
Well, the reality is if you divide up the 700,000 urgent appointments across the 24,000 dentists that are currently offering some element of NHS care, that's only 2 appointments a month. In my practice, we have over 200 people waiting on our waiting list for dental care. And urgent treatment is great. It allows access for those patients in severe pain, needing extractions. But what happens afterwards? There is no real commitment. There's no real support for dentists carrying on that care. So those patients need not just one single urgent appointment, they need continuing care. Dentistry is based around prevention, looking after those patients, prevent them having future dental disease. So one single appointment, or in this case, a couple of appointments per month for a practice is no benefit whatsoever.
We heard that patients have ripped their teeth out and that children's teeth are often rotten. Have you seen examples of this firsthand?
Yes, I have. We have new patients coming to the practice, children who have multiple teeth that are decayed. We have kids who are 5, 6, 7 years old who have had all their baby teeth taken out when they were younger, simply because of tooth decay. And in the 21st century, we should not be having a system that tolerates that level of malcare or poor access to dentistry. Some of it's advice, some of it is the dental care provided by the parents themselves, but often it's just inability to access dental care. And the biggest reason for appointments for general anesthetic for children is dental extractions, which is bizarre. And we see patients having to do their own DIY dentistry. It's not something we should be seeing in the 21st century in the UK. They struggle to get a dentist, so they take pliers to their own teeth. Obviously, these teeth are going to be reasonably loose, but it's still done without local anaesthetic. It's done in sort of difficult conditions at home using instruments that are not clean or disinfected. We shouldn't be in a situation where we can't allow people access to a basic NHS service.
What are some of the reasons causing a decline in oral health?
There's two elements to the decline in oral health. One is the fact that it's not free at the point of delivery. Whilst people constantly say the NHS is free at the point of delivery, it isn't for dentistry, and it hasn't been for since the 1940s. So patients will have to pay, and some treat for, and when you've got a family with 3 or 4 kids, you will have to pay for your treatment. But obviously, for children, you're exempt. Children have to pay for under 18s. But it's access to care. Sometimes it's also fear. Parents have fear of dentistry themselves, and that fear is passed on to their children. So their reluctance to go to the dentist also pass on to their children. So trying to get that education across, and also not being aware of things like bottle feeding children with sugary drinks or sweet drinks at night. All those things contribute to early decay in children. But also cost is a barrier. If you are not exempt, and there are just small groups of people who are exempt from treatment charges, dental treatment charges, you end up having to pay quite substantial amounts of money. If you're talking about £26, £73, £319 if you need crowns or dentures, that's not an insubstantial amount of money in this day and age.
NHS England has written to integrated care boards across the country, instructing bosses to stand up thousands of urgent appointments over the coming year. Let's go to the ads. Coming up in part 2, The Standard's food and drink writer Josh Barrie from 40 Hall Vineyard in Enfield. The vineyard is located on a rolling 170-acre mass of land that dates back to Tudor times. Welcome back. As part of the Standard's Hidden Gems series, food and drink writer Josh Barrie took a trip to London's 40 Hall Vineyard. Located in Enfield, it is just 2 miles from the M25, and on a clear day you can even spot the Shard. Josh met with local Emma Lundy, who runs the vineyard and spends her days working with students from Capel Manor, as well as scores of volunteers who descend on the area come harvest time.
Can you tell me a bit about the wine that you produce here, the champagne and the still?
We have 3 varieties that make up our champagne blend, Pinot Noir, Pinot Meunier and Chardonnay. And then we have 2 still white varieties, Bacchus and Ortega.
When was the vineyard founded, and how many bottles do you sell a year?
It was founded 15 years ago by a lady called Sarah Vaughan Roberts, and it was set up as a community vineyard, but we're always with the intention of creating really good wines. Now we produce anything between 8,000 and could be up to 30,000 bottles from the grapes we produce.
We're in a field, it's a brisk winter's day. You know, I can see these beautiful vines, some pigs and farm and so on. Can you tell me a bit about the terroir here and the climate? We're sandwiched between a bigger city in the UK and the M25, so, you know, how does it work?
Well, we have good soil here. We have perfect soil. It's quite a lot of clay in it, quite chalky. So we have good soil for growing vines. But the other benefit that we have being so close to London is the temperature is a few degrees warmer. So that really benefits us and sort of gives us a week ahead in terms of our ripening of the vines.
So, you know, being so close to London, do you sell to many London restaurants that we might have heard of?
Yeah, we do sell to London restaurants, but we would need to build up that link, I'd say. We had a couple of years where we weren't selling to trade. We were just selling direct to our customers ourselves, because we'd had a couple of, or 3 poor years of harvesting and low yield. So we reduced our trade sales. So we're really looking to build up that network again. But when we were selling to lots of London restaurants, it's really popular. Yeah.
And so as a brut, the champagne style English sparkling wine, is it the only one produced within the M25?
Yeah. Oh, well, from London grapes.
Yes.
That really is our unique selling point, in that we're creating wines that are produced. There are other London wineries, but we're producing from our London grown grapes.
How might someone from town or anywhere in London or anywhere in the country come and visit, and when's a good time to do so, to come and taste some of this white wine?
You can buy the wine online, and you can come up to the farm shop here at Forty Hall Farm, which is open Tuesdays to Sundays, 11 till 4. And then in the spring, the farm will reopen at the weekends for visitors. And on the second Sunday of the month, we have a farmers market that starts in April. And at the end of March, we have a lambing weekend, which is a really fun event for people to come along. They can have a wander down here, see the vineyard and the rest of the brilliant farm that we have, pick up some produce, all organic, locally grown, and loads of other producers that come along as well. So it's a really lovely day out.
You can read more and watch more of Josh's trip via the link in our show notes. And that's The Standard. For all the latest news, head to standard.co.uk, and please do get in touch with us. This podcast returns on Monday. We'll see you then.